This is Dr. Jason Lichten, board-certified plastic surgeon and founder and director of Central Ohio Plastic Surgery with offices in Lancaster and Columbus, Ohio. Today we're going to talk about how do you know if you need a breast lift along with your breast implants, or just a lift. And the answer is you've got to start with a consultation. You've got to see a board-certified plastic surgeon and let us review what your goals are, what size breast you have now, and what the condition of your breasts is. And by condition, I mean is really how much droop, how much flatness across the upper part of the breast do you see, because that's going to determine what the plan we should choose for you and what the best way to go about doing that is. In general, a breast implant augments what's there. So all the breast implant's going to do is add volume. It's not going to necessarily lift the breast or shape the breast differently. It can give a little bit of the illusion that the breasts are lifted, because the volume then of the implant stays in the upper part of the breast. But if the skin of the breast and the nipple hangs below the fold, often we'll want to reshape the breast to lift and restore the breast to its natural form that is more aesthetically pleasing for you. Some people describe a pencil test, where essentially if you can take a pencil beneath the breast and it will stay there, the skin of the breast holds it in place, you may want to consider a lift. In reality, it has a lot more to do with the upper pole, how much of that tissue here feels flat. If you feel as though things really just sort of hang off your chest, a breast lift can help lift and shape the existing breast tissue and skin so that when you put an implant in, that it shapes the body and breast and gives the normal proportions and balance. It's important to note that doing a breast lift will tighten the skin, and doing a breast implant stretches the skin. So you're automatically starting out fighting against yourself in two different directions when you do this. The bigger the implant and the more degree of lift that you have. I've had patients who've had bariatric surgery who feels as though their breasts really hang all the way down to their waist and feel completely deflated, who then want to get to a fuller volume of their breasts, which will require a bigger sized implant. That combination often we will need to stage into two operations, but for the most part, for most patients, we can, with a modest sized implant and a modest sized lift, combine those together.